In this lecture, we will discuss how to identify the electrode responsible for an artifact. Artifacts on the EKG almost always come from sources unrelated to the monitor, and there are multiple types of artifacts to consider, including motion artifact, there's muscle artifact, electrostatic artifact, there's something called pore contact artifact, electromagnetic interference is one, as well as implanted stimulators like pacemakers can cause these artifacts. We will discuss some of these types in future lessons. Now, it's important to note that these artifacts are just as the name implies. They are artificial in the sense that they are not natural. That is, they originate from outside of the heart, okay? They're not originating from within the heart. That's why they're artifacts or artificial, okay? And if you look here, this is our artifacts that we're talking about. Notice that in lead 3, it looks pretty flat, pretty normal. We can make out a P wave, a QRS complex, and our T wave here, okay? And now we should also be aware that what we want to do here is identify the culprit electrode of an artifact. And it's really not too difficult. First, let's review the electrode placement in Einthoven's triangle quickly. Okay, so remember Einthoven's triangle, there's the 4 electrodes. We have the right arm, we have the left arm, we have the left leg, and the right leg, or the neutral electrode. Okay, and we're looking at the limb leads here. We have lead AVL as an augmented lead, lead AVF, and lead AVR. And then we also have the other limb leads, 1, 2, and 3. Lead 1 goes from the right arm to the left arm, heading in this direction. Okay. Then we have lead 2 going from the right arm to the left leg, heading in that direction. And then we have the lead 3 going from the left arm to the left leg, heading downwards towards that left leg's electrode. Okay. And if we were to draw these on our frontal plane, okay, here's 0 degrees. This would be positive 90 degrees, plus or minus 180 degrees, okay? And then negative 90 degrees, we know at 0 degrees, we have lead 1, the positive end of it, okay? We have lead AVF at positive 90 degrees. And then we also have lead 2 that comes here at positive 60 degrees. So this is lead 2, okay? It's positive end. We have lead 3 that is right here, and lead 3 is at positive 120 degrees. We have at negative 30 degrees, AVL, positive end. Okay, and then we have going over here, AVR, and AVR is at negative 150 degrees. Okay, so those are our 6 limb leads that we have here. Okay, so if we see an artifact in leads 1 and 2, but not in lead 3, this means that the right arm electrode is the source of the artifact. So how do we know that? Okay, so you can actually see this in the example. So leads 1 and leads 2 have artifact in it, but lead 3 is okay. Okay, so let's just erase this so we can figure out how do we know that the right arm is the one that's responsible for this artifact. Okay, so let's see, lead 1 is here. It has an artifact in it, and so does lead 2. Okay, we said lead 3 is okay. So what are both lead 1 and lead 2 intersecting at? Okay, so if you look here, they're both common electrode is the right arm. So it's likely that the right arm electrode is the culprit electrode for the artifact. So 1 and 2 are okay, have the artifact, but lead 3 has no artifact, and that's why we see the right arm is the one responsible. Okay. Now, what if we have artifacts in leads 1 and 3, but not lead 2? This means that the left arm electrode is the culprit one. So how do we know that? Okay, so now we're looking at the next one below. So leads 1 and 3. Okay, imagine that here's 1 and here's lead 3. They have artifacts in it, but lead 2 is okay. So which one is the culprit electrode? Well, it would be this one here, the left arm. Okay, both common intersect at this left arm electrode. So that's the culprit electrode for the artifact. Okay, let's see the other one. So what if we have an artifact in leads 2 and 3, but not in lead 1? Well, then we know that the left leg electrode is the source of the artifact. Okay, so let's see this one again. We'll erase this. Okay, so now we're looking at artifacts in 2 and 3. Here's lead 2, here's lead 3. They both intersect here at the left leg. So the left leg is the one that's our culprit electrode, and lead 1 would be normal. Okay, so hopefully that makes sense. Okay, so that's the artifacts in the limb leads. Okay, in leads 1, 2, and 3. Now what if we saw an artifact in one of the precordial leads? Well, this makes it actually pretty easy. If the artifact is unique to one precordial lead, then the precordial electrode is that source. Okay, so if you look here, if here's lead V1, V2, and V3, which one has the most artifact in it? Well, it's certainly lead V2. Okay, so in this case, all we'd say is that it's unique to V2, so V2 is the one that is responsible for the artifacts that we see. Okay, so make sure you check lead V2. So hopefully this is all making sense. All right, let's review what we discussed before we end here. So artifacts is just an artificial finding that's not coming from the heart. We mentioned there's muscle artifact, muscle, or motion, muscle, there's electrostatic, pore contact, the electromagnetic interference, as well as implanted stimulators. Okay, and we'll look at some of these in the upcoming lectures. Now, what I want you to get from this are these main points here, okay? And all you really have to do, as you've seen, is draw out Einthoven's triangle for these and look at the ones that have the artifacts in it. Where they intersect is the one that's responsible for the artifact, okay? So that electrode. And we mentioned if we see artifact in 1 and 2, as we saw here, then it's the right arm that's responsible for that artifact, okay? And you can see that if you just work them your way through, and you'll see, just like with limb lead reversal, make sure you know how to draw this out. It can really help you instead of having to memorize everything, okay? And then lastly, with the artifact in the precordial leads, remember, if the artifact is unique to one of the precordial leads, then that precordial electrode is the source of the artifact, okay? Well, that's the end of this lecture. We discussed how to identify the electrode responsible for an artifact, and I hope you learned something.